I'm here today with Dr. Joseph Cipriano of Lumiere Cosmetic Vein Center in Cape Coral. And we're here to talk a little bit about your business.
Sure.
So for someone who's never been here before, how would you describe Lumiere Cosmetic Vein Center?
Lumiere Cosmetic Vein Center is a very patient-centered office practice. We work very hard at trying to make sure patients are educated, informed, and in control of the directions of their treatment path. I do a lot to help make sure patients know they have the control that they need, but also the direction. I classically will say they're the captain of the ship. I'm the first mate. I'm going to educate you, but you're going to tell me how you want to drive it.
Right. Love that. Love that. So what made you want to combine vein care with cosmetic treatments?
Well, my original reasons was as a hospital-employed surgeon, I would see venous disease in its most severe situations, wounds, sores, ulcers. And not most of my patients here in the real world experience that. Only 3% do. But in the hospital, 100%. Every patient I saw, wounds, sores, ulcers, life or limb threatening. I see it as a natural extension from the cosmetic to the medical, and it truly is. You really see that every day.
Yeah. What are the most common concerns that people walk in here with?
They don't like how their legs look, but they ignore...
Who does, right?
Right. They don't like how their legs look, but they ignore the symptoms that they have with it. They've put it into the background noise of every day-to-day life so they can get through one day to the next. You can't go to the next shift. You can't work the next job. You can't make the next paycheck if you're thinking about every ache and pain that you've got. So it gets buried in that background noise. They forget about it or don't think about it until I start to reveal that symptom being there. When we sit there and question and query, they're like, oh yeah, it does ache, or it's a little harder for me to walk the same distance as I used to. We start to tease out those details, and that's really where the problem is in those details.
Very interesting. I could see that.
Sure.
As busy women, you just plug along.
Right.
You move forward.
Right.
So when somebody's interested in injections or cosmetic procedures that you do here, how do you help them decide what's actually appropriate for them?
A lot of times people come and ask for injections for something that, unfortunately, if we were to inject it at best, would only cause staining. And I want to make sure I educate people that if we were to treat this in the cosmetic natural way that you would treat a spider vein, this is too large. It's got too much blood in it. It has access to the deep system, and it can hurt you if I was to do it. That's in the worst case scenario. We don't want to hurt you. Safety, efficacy of treatment, comfort, and it's always in that order. Safety is never compromised for the other two. So to keep patients safe, I'm always educating and making sure they understand what's appropriate for what they're asking us to do. With injections for cosmetics, we're always trying to tether that to what's safe. And so usually, I would say at least 95% of the time, people come in with queries or questions about something that they feel is cosmetic, but as we sit there and have them stand up and spin, and you can see shadows down their legs, and they always thought it was fat. And I say, that's not fat or cellulite. Those are veins under your skin. Those are sharks under the water that you can't see. But with our ultrasounds, we can see.
Oh, wow.
Right.
Very interesting. So you also do cosmetic injections, Botox, filler, all of that. How do you keep results looking natural?
With that, I do take time and effort to include, again, the patient in what we're doing. We spend a lot of time with a mirror. I sit there with a little Q-tip, and we're pointing out areas and what we're looking at and talking about what we can do and accomplish. Natural losses of collagen and muscle mass as well as fat mass in the face, that's natural as we age. So we do a lot of education on that, and we take our time. I pride myself on conservative treatment. We try not to go overboard and over too much. I will talk you out of spending money. I don't want you to spend money. I want you to be happy. I take expectations and bring them to reality. And if you want things to be natural, it doesn't happen overnight. You have to build a good foundation to get good walls, to get a good roof. So we have to actually take our time and build the structure that you want.
That's great. So you kind of answered this. What do you wish more people understood about cosmetic injections? It sounds like the journey.
It is. It's always a journey. And that's what we build here when we have our patients and we see them. I do tell people it takes time to accomplish what we want to have happen. I really have to have a good understanding of what you want. And so that rapport, that discussion, that back and forth, that I need to know what you want. And to actually do what you want, we have to have that ability to talk. So constantly, we're always trying to build up that rapport, that discussion.
Yes, such a consultative approach.
Sure.
For sure. So for vein concerns, what are some signs that someone should come in for an evaluation? Some of the symptoms you talked about.
Sure. So they will not as often as you think see visible veins, or if they do, they're very small. More important is loss of architecture or anatomy around an ankle. Like if you can't see that ankle bone well, or you used to and you can't, or in the morning you can and then at the end of the day you can't. Those are very common signs.
So swelling.
Swelling, definitely. But if I say edema, some people don't know what I'm talking about, but swelling people know. Another one is restless leg syndrome. I get that one so often, and people think that's nerve related or back injury related, which don't get me wrong, nerves can play a role, but I will say more often than not, it's vascular. We're not circulating blood, waist backs up, and we're not getting good salt balance. And with that, we're getting restless leg syndromes.
Interesting. So, I mean, sometimes people say magnesium.
Sure, yeah, and again, it goes back to electrolyte derangement. You're absolutely correct. But what makes sure electrolytes get where they need to and not where they need to be? Circulation. Circulation's ubiquitous.
Right.
We have to carry what we need to and
can't
from.
Get down to the extremities.
Right.
Really interesting. I find all this fascinating.
I do too. I deal with it every day.
So are vein treatments mostly cosmetic, medical, or can they be both?
Both. Usually both. And it's mainly because I see people because they're worried about the cosmesis. But as then we reveal, there's layers of problem and that we can see. Out of the thousands of patients I've seen, I won't say that it's more than 50 that I've seen that are true cosmetic. They're usually layers of problems. Now, as to what they want to do with it, again, they're directing the show. I will do and abide by what they want, but I also have to bring their expectations back down to reality. I can't promise something that we can't do, nor should I promise something that's not safe.
Right. So what's one treatment people are most nervous about, but later say it was much easier than they expected?
All the vein ablations, any and all the vein ablations. Even sometimes with the sclerotherapy, people are worried, but we use needles that are smaller than your hair width. So I mean, they're worried about that, and then we inject, and it's like, oh, I didn't even feel you do it. And I was like, that's the advantage to using such small needles. You have very limited pain. When we get to the vein ablations, we're talking about a much more involved process and procedure. So people are scared about it, and not that people don't have pain. I never am ever going to say anything's painless. But for the benefits, they far outweigh the risks of the pain. And we sit and talk the patients through each and every step. I'm talking them through each and every time we're having a pinch or a burn. We start and stop whenever they feel comfortable. On rare occasions, people are having very tender or sensitive situations. We stop. We bridge them to the next procedure with compression and conservative measures. We get them through it.
Good. So I think you just told me what makes Lumiere's approach different from a typical med spa.
Right. It's a very patient-centered approach. I put as much power as I can into the patient's hands to allow them to help control what happens. Again, always efficacy or attention to safety, efficacy of treatment, comfort. In that order. 1 is not sacrificed 2, 1 and 2 aren't sacrificed for 3. We will always make sure safety is number 1, comfort's efficacy of treatment is number 2, safety, efficacy of treatment, comfort. In that order.
Right.
Yes.
Right. What do you love most about helping people feel better in their skin?
The appreciation we see. I've got patients that I've been following for well over 5 years now, as I've been practicing now 6 going on 7. And they continue to return as they need for one thing or another. And as patients' legs feel better. Before we started, they didn't have pain. Then, as we've resolved the medical issues, they know what normal now really feels like. And when pain comes back and they can see it and feel it for the first time, not in decades, but now in days or weeks or months, they can see the changes. So I can see that they're aware, and because they're aware, we can address things much earlier. It's never as bad as it was when we first start, but if we have to do repeat treatments later on, it's much smaller, much easier scale.
Right. Do you have patients coming back for once they do one treatment that they come back for different services, different treatments?
Definitely aesthetics or cosmetics later if they want to, but nothing at the same time. Obviously, we're wanting to make sure the medical's addressed, and you'd be surprised 75% of the cosmetics get better with control of the medical because the cosmetics stem from the medical.
Absolutely.
So a lot of times they're asking me, well, can you do cosmetics before or at the same time as doing the medical? And it's like, if you give me just a little bit of time, you'd be surprised at how much goes away without us not having to touch it again. Again, going back to the fact, I'll talk them out of spending money rather than spending money on something. I don't like wasting time or money. The only thing I hate wasting more than money is time. Yeah.
So I've known Dr. Cipriano since he was opening his doors.
Right.
We actually partnered on some things when I owned a wellness spa here in Cape Coral that I no longer own. So I can speak truthfully and honestly that his approach is very consultative, and everybody that I've referred to him still comes here.
Thank you.
And I've been a patient for different things, and it's definitely a well-run and trusted organization, and I owe a lot to Dr. Cipriano for stepping out and doing something a little bit different with the vein center here in
Thank you.
Cape Coral.
Thank you.
So for somebody watching who's been thinking about coming in but feels hesitant, what would you say to them?
I would always reassure them. Ultimately, you can come in and ask for information and education, and it can go only as far as that, never having to commit to anything above and beyond that. Because it can just be as simply, you just need to have more information. We're not here to pressure you or stress you at all. We wanted to make it a very easy, comfortable environment. Everything we can to make you at home here, and an easy glide into good information. Education is almost as important as the treatment, if not more. Yeah.
Just try it. So before I ask my final question, I want to ask, what is your favorite transformation to see in patient?
Wounds. When I see wounds and patients, and I know this sounds sometimes horrible, but people do present with very specifically horrible discomfort associated with wounds, or no pain at all, but wounds down to muscle and bone. And they'll have had them for months, if not years. And as we're able to garner control, meaning now we've got the veins out of the way, circulation can happen again. And as circulation, the circuit's intact, oxygen, sugar, protein gets there, waste, urine, acid gets up. The wounds go away within the space of a week or two. And they've had the wounds for years. And we're able to make it so that happens. The other, mobility, exercise, activity. Hundreds of patients have specified, I can get out of a chair easier now. And I was like, it's because we're perfusing your muscles. We've gotten the veins out of the way. Now the arteries can feed, and all of a sudden they can get out of chairs easier. They're more stable on their feet. They can walk with or without a walker, now with a cane or otherwise. So I see that every day.
Yes, amazing. I love the science behind it.
Sure.
Okay, so what do you hope people feel when they walk out the door?
I'm hoping that they feel that comfort, safety, know that they can always call or come to see us. I've had patients come to see us for questions well outside the range and scope of what I can do, but I can always get them in contact with whomever they need. I do everything I can to help triage information as best as I can for them. I want them to feel comfort, though, knowing that they can come back and see us and ask us any question, and I can help give them some answer and guidance.
Okay. Anything you want to say? Anything coming up?
I appreciate
promote.
Actually, we're looking into HVOT. We're getting ready to start hyperbaric oxygen here on site, longevity and wellness. Cool. And obviously, I can't specify and go down the pathway of wound care technically because it does not fulfill criteria for wound care that's required by insurance. But for patients that are interested in use for it and everything that it can accomplish, it can get oxygen to the nth degree of our digits, the nth degree of our legs and hands, so it can help with any wound care issues. Without it technically being wound care oriented with an insurance application.
Wonderful. Wonderful. Well, thank you so much for giving me precious moments of your time to talk about Lumiere Cosmetic Vein Center and your treatments here. Perfect. And I'm looking forward to putting this up on my YouTube channel and letting the world know about Dr. Joseph Cipriano and Lumiere Cosmetic Vein Center.
Thank you, Carmen.